Welcome to this clinical walkthrough on the surgical abortion counselling case for the UKMLA, brought to you by Mediate, your 24/7 practice partner. In this explainer, we are going to break down exactly how to approach this sensitive station, so you can walk in feeling confident and score maximum marks. So how are we going to do that? Well, we'll be using the CARE framework. This is such a powerful tool for pretty much any communication station. That's C for clarify, A for assess, R for respond, and E for empower. It's a really solid structure that will guide us right from the start to the very end of the consultation. Okay, let's dive in. All right, first things first. We need to set the stage. Before you even walk into that OSCE room, understanding the exact context of the station is, well, it's absolutely critical for a strong, confident start. So here's the setup for this one. You're an FY2 doctor working in a GP surgery. Your patient is a 32-year-old woman, and she's 8 weeks pregnant. Now listen closely to her request. She's already booked for a surgical abortion next week. She's not here to decide. She's here because she wants to understand exactly what the procedure involves. Your job is to explain it clearly and, of course, supportively. Okay, let's get into our framework, starting with C for clarify. This is all about building that instant rapport and really getting to the heart of what your patient needs to know. You don't want to just jump into a pre-rehearsed speech. The first step is always to listen. Your opening needs to be warm, professional, and really open. Something simple like this. Hi, I'm Dr. Name. How can I help you? It's perfect. It invites the patient to tell you what's on her mind in her own words, which immediately builds a connection and puts you in control of the consultation. From there, you just need to probe a little, very gently, so check if her decision is firm. Find out what she already knows about the procedure. But this next one is key. Ask her what she's worried about. Are there any specific things? This is what takes your consultation from generic to truly patient-centered, and that's where the marks are. Then just confirm her goal. So just to confirm, you like to understand what to expect? It shows you're really listening. So once you've clarified what the patient wants, it's time for A, assess. Now, this isn't a full-blown medical history. No, this needs to be a focused history, really aimed at making sure the procedure is safe for her and checking that she has the support she needs. And to keep it focused, I want you to structure your questions around these 4 key areas. You're going to cover her pregnancy and reproductive history, her menstrual and contraceptive history, her general medical and psychosocial background, and finally, her wider support system. So for her reproductive history, you'll need to ask about past pregnancies. Has she had children, any miscarriages, or any previous terminations? And don't forget to ask about any past gynecological or even abdominal surgeries, as these could be really relevant. Next, you've got to screen for those key medical issues. You know the drill. Ask about conditions like diabetes or high blood pressure, check for any known allergies, and find out about any regular medications she's on. This is all essential for the safety of the procedure and the anesthesia. And please don't forget the psychosocial side of things. It is so important to gently explore her support network. Questions like these can help you understand her emotional state. And a top tip here, always preface these questions by saying something like, you don't have to answer anything you're uncomfortable with. All right, we're ready for R, respond. You've gathered all the key information, and now it's time to give the patient the explanation she came for. The absolute key here is clarity, structure, and a calm, reassuring tone. The best way to do this is to structure your explanation chronologically. It just makes it so much easier for the patient to follow along. I really recommend these 4 steps: preparation, anesthetic, the procedure itself, and then aftercare. See how that breaks a pretty daunting process down into smaller, manageable chunks? So let's start with preparation. You'll need to explain that she'll be given some medication to help soften her cervix. It's good to mention the 2 common options, misoprostol or mifepristone, and just briefly say how they're taken. And always, always finish by reassuring her that the clinic will give her very specific instructions on the day. Now, when you're explaining the procedure, you should use its proper name, manual vacuum aspiration, but immediately follow up with a simple, jargon-free description just like this one. And, mentioning that it usually only takes about 10 to 15 minutes can be incredibly reassuring. Explaining this procedure in a way that's both clear and compassionate really does take practice. Remember, watching me do it is one thing, but actually doing it yourself is another. So why not practice this exact case with a simulated patient and get instant objective feedback on mymedi8.com? Okay, let's move on to the final and I'd argue most important part of our framework, E for empower and safety net.
This is where you tackle common fears head-on, give crystal clear advice on what to do if something goes wrong, and make sure your patient feels supported long after this consultation is over.
A huge concern for so many patients is about future fertility. You have to address this proactively. Don't wait to be asked. A clear, reassuring statement like this one can relieve a massive amount of anxiety. Notice how it's framed positively, emphasizing that in most cases, there are no long-term effects.
Now, your safety netting advice needs to be explicit. Don't just say, call if you feel unwell. You need to give concrete red flags. For example, tell her to seek help for heavy bleeding, and then define what that means, like soaking 2 pads an hour. Mention fever, foul-smelling discharge, or severe pain. And crucially, tell her exactly who to call. And finally, empower her with clear next steps. Let her know that contraception can be discussed and arranged at the clinic. Advise her to take a pregnancy test in 3 weeks just to confirm everything is complete, and offer information on emotional support services like UPass. This shows truly comprehensive, patient-centered care.
And here we are at the final step, closing the consultation. A strong ending is so important. It reinforces everything you've discussed, gives the patient one last chance to ask questions, and leaves her feeling heard, understood, and supported. So, you want to end by checking for any final questions. But then, do this. Validate her. A statement like, "You've done the right thing by asking these questions," is so empowering. It normalizes her need for information. And reassuring her of ongoing support, well, that's just the perfect way to wrap things up. And there you have it, the CARE framework applied to the surgical abortion counseling station. If you follow this structure, you'll be able to provide care that is clear, compassionate, and safe. So now it's time to put this all into practice. You can head over and practice this exact case and so many others right now on mymediate.com.